Are you thinking about being tested for HIV? Are you wondering what types of tests there are, whether you can be tested for free, and whether you have to give your real name? Or have you received a test result and are now wondering if it is correct? Welcome to Common Questions about HIV Tests. My name is Dr. Becky Kuhn. In this video, we will answer common questions about HIV tests. How do HIV tests work? There are many different kinds of HIV tests. In many places, you can even buy an HIV test kit at a pharmacy. Some HIV tests look for the virus in your blood. Others look for antibodies, which are substances that your body produces to fight HIV after you've become infected. What are the window period, eclipse period, and false negative test results? When you are first infected with HIV, tests will not show that you are HIV positive immediately. If you take an HIV test at that time, you will get a test result of HIV negative that is incorrect. We call this a false negative. This period of time is called the window period or eclipse period. Ask your doctor how long after your most recent possible exposure to HIV that you must be tested to be sure you have not contracted HIV. If you think you may have been exposed to HIV or have signs of early infection, it's important to get tested. Go to the doctor, tell them the reasons that you think you might have early HIV infection. Are HIV positive test results ever incorrect? Do false positive results ever occur? HIV tests aren't perfect, but if a doctor tests you for HIV and you follow all their instructions, including any follow-up testing, HIV tests are highly reliable. There's a lot of misinformation about HIV tests. There are people called HIV denialists who falsely claim that HIV isn't the cause of AIDS. Videos and websites on the internet by HIV denialists often talk about incorrect HIV positive test results and exaggerate how often they occur. HIV denialists are usually talking about incorrect HIV positive results on the first test in a two-test sequence that was commonly used in the past in the United States. Current HIV tests are even more reliable. If your doctor tells you that you are HIV positive, believe them. The odds are extremely high at that point that you are in fact HIV positive. If you have any doubts about whether your HIV test results are correct, talk to your doctor. Can I be tested for free? Yes. Just about anywhere in the world, if you can get to a public health clinic or sexually transmitted disease testing center, you can be tested for HIV for free. Don't let the fact that you don't have health insurance or can't pay stop you from getting tested for HIV. Can I be tested without giving my name? Yes. If you want to be tested for HIV but don't want to give your name, there are several ways you can do this. Let's talk about each one. Anonymous testing. In some places, you can go to a public health clinic and tell them that you want to be tested for HIV anonymously. That means they will test you for HIV without writing down your name. Confidential, name-based testing. Not all places have this kind of anonymous testing program. In some places, you must give a name when you are tested. They keep the name secret and do not make it public. This is called confidential name-based testing. If you don't want to give a real name, you don't have to. Don't let the need to give a name stop you from getting tested for HIV. Home-based testing. Another way to be tested for HIV is to use a home-based test kit that you can buy at a pharmacy. You don't need a prescription to get the kit. You just go to the store, buy it, take it home with you. At home, you follow its instructions to get a sample of fluid from your gums. You mail in your sample and then call a phone number to find out your results later. No one knows your name because you get your results using the number from your test kit. This way is not free. You do have to pay for the test kit, but you don't have to give your name, and you can do it right in your own home. Do I have to be stuck with a needle? HIV tests that you buy in a pharmacy only require a sample of fluid from your gums. Some HIV tests are performed using a small needle stick in the finger. The most reliable tests today do require having your blood drawn. If I get a result of HIV positive, does that mean I'm going to develop AIDS and die? It doesn't have to. People who are HIV positive can make choices that will improve their chances of living a long, healthy life. If a person learns they are HIV positive and follows their doctor's instructions, including the use of HIV medications, they may be able to avoid developing AIDS for years, decades, or possibly for the rest of their life. Why should I get tested? It's quick, easy, free, and your private life is protected. If you're HIV negative, it will keep you from worrying needlessly. If you're HIV positive, it can save your life and the life of your sexual partners or unborn child. Health experts tell us to get tested, so don't wait. Do your part in the global fight against HIV. Get tested. For AIDSvideos.org, this is Dr. Becky Kuhn.